I am Ramaswamy Govindan, a medical oncologist, a professor of medicine at Washington University in St. Louis. So what are the most common causes of lung cancer? And the question often is, how can we prevent lung cancer? The answer is, in some respects, fairly simple. Stop smoking or do not start smoking. And that, I think, is the most important thing. If people stop smoking tobacco today, if tobacco smoking goes out of this world instantly today, in 20 to 30 years, the lung cancer incidence will drop down by 90%. That's 90%. So 90% of lung cancer that we see today are caused by tobacco smoking. Approximately 10% we see, 10% of lung cancers we see in patients who have never smoked tobacco or never lived with somebody who has smoked tobacco for a long time. And so that poses some interesting questions. What causes lung cancer in these patients? Again, the short answer is we don't know in most instances. The possibilities are exposure to radon. Radon is a gas that is present on Earth. It's the part of this planetary system, and in some instances, some basements have higher exposure, higher levels of radon gas. And these days, before you buy a home, or if you want to check that in your basement, you can do this within a matter of a few days. And the EPA has set some limits on what they say if exposure to radon, and you can always check if you're concerned about that. And there are mitigation strategies if the radon levels are high in your basement. But that, while potentially it can cause lung cancer, I don't think that explains almost the vast majority, I should say, of the non-smokers' lung cancers we see. We and others are specifically interested in studying this, and we are now looking at various different ways of identifying that. There was a time we would ask extensive questionnaires, and depending on that, we'll try to come up with some epidemiological answers to these problems. Nowadays, we are trying to study the tumor gene alterations and see whether we can deduce from that what could have caused this cancer or what might have caused this cancer. You may be interested to know that today, if you can have a patient's tumor profile done by studying the DNA or the gene sequence, we can figure out what caused the damage in the setting of tobacco smoking. For example, if I'm given a sample or a set of data from a gene analysis of a tumor sample from a patient with lung cancer, if I didn't know whether the patient smoked or not, I could look at this and say, very likely this patient had smoked and then that caused cancer, because we can see the smoking cancer-causing chemical-related damage in the DNA. It leaves behind a signature, what we call signature in the gene sequence, and we can find that. So we are extending that kind of a knowledge to see, can we now go back and look at what other causes or what other factors could lead to lung cancer in patients who don't smoke tobacco or who report no smoking tobacco. We have not been able to really narrow that down. There are a lot of interesting things we are pursuing. Exposure to heavy metals like arsenic, cadmium, they have been historically linked to development of cancer and possibly lung cancer. And we are trying to see whether we can discern those things by looking at the signatures in the tumor, gene architecture. And also there is some concern that exposure to fumes or pollution can cause this cancer. So at the moment, these are possibilities, but at the best answer I can give is if anybody, if they're smoking, they should stop smoking immediately or as soon as possible. And I think that's the most important thing. Smoking is bad. There is absolutely no doubt about this. And stopping smoking anytime is a good thing. The best thing is not to start this at all. And clearly, the kids, we have to really work hard and to prevent children from kids from getting teens from getting hooked on to tobacco smoking. And once they start early on, it's very hard to stop. And those are the people who struggle to quit smoking. And I think that's the most important thing. Number one cause of cancer prevention is lung cancer prevention is avoid tobacco smoking. What about patients who have smoked for a long time and quit smoking? For those, we have some good news. Lung cancer screening through CT scan annually appears to decrease the death rates from lung cancer. So please talk to your primary care physicians if you or your family members have smoked for a long time and concerned about lung cancer. CT screening for lung cancer, like mammography for breast cancer, colonoscopy for colon cancer, CT screening for lung cancer helps saves lives. So that's the second important message I have for you.